but I've said it and I'll stand by it, right? Like if I was designing this system from scratch, like this would not be it,
Yeah,
right?
yeah.
Like it's just not
I don't think
optimal.
no one can look at the cost and outcomes and say that like this is the best
No,
structure, right?
not at
Are there
all.
countries, and I haven't gone detailed into looking, I know there's many countries that have much better cost and outcome than the United States does.
Almost basically
Every single like
every developed
developed
country
country is
out
better.
there.
Yeah.
Yeah.
Is there anyone you really admire, like how they've administered from a country standpoint, how they've gone about doing this?
Yeah, I mean, I think so. Fundamentally, I think the countries that do well, first of all, start with a notion that every single human in that country should be entitled to healthcare coverage in some way, shape, or form, irrespective of their ability to pay.
Which sounds like such a like it becomes so politicized in some way, like everyone deserves healthcare. But like even from a capitalist perspective, right? Like let's take the humanity out of it. Like starting from that premise bends the cost curve of the
That's
totality
correct.
of what we pay,
That's
right?
correct.
It's like it's good business,
It's
quote
good
unquote.
business.
Yeah.
It's good business. It's good business. These countries have said it behooves us to use taxpayer dollars to ensure, in addition to employers, and they've all figured out different ways of doing this, to ensure that every single person has access to healthcare. Like, period. So like starting there, and that is a sort of a universal truism of all of the countries that perform better than we do in terms of value for dollars spent in the healthcare
Yeah.
system. And just even looking at mortality, right? Like look at the mortality, average life expectancy in all of these countries relative to the amount of money they spend in healthcare, and we are a complete outlier in the United States. So starting with coverage, critical. The second piece is that we in the United States have been really slow. This is such a tension between the way we think about capitalism and the way we think about government and regulation. We've been really slow to regulate parts of healthcare that are very much subject to market failures. So exactly what you said, right? Like you have no incentive as a consumer to price shop for MRIs, and we haven't created any way of addressing that information for you, as an example. So there's an information asymmetry. Pricing is completely opaque to most consumers in the healthcare system
And why is that? Just because of the incentive structure that comes
because
with
of
it?
the incentive structure that
Yeah.
comes with the insurance
Yeah.
system. We've allowed it to become so opaque, so rife with opportunities for arbitrage, and so invisible to consumers that it's impossible for consumers to make rational choices about how they use their healthcare dollars, even when you're at risk for them through your copays, through your deductibles, through your premium over time. So like and we're just starting to see people chip at that, but even things like saying, well, should we put price caps on healthcare services? Should we actually just cap how much anyone anywhere can charge for an MRI? And this country's been unwilling to do that, right? Um, Other countries say, yes, absolutely, we should. We know how much it costs to do an MRI, and we're going to say there shouldn't be, we're going to cap the spread between the lowest cost provider and the highest cost provider, and we're going to cap their ability to make profit on that spread because we believe that access, transparency, visibility to an understanding of how much things cost is more important in ensuring that we're, again, efficient fiduciary. We have a responsibility to the way that we spend our taxpayer
And
dollars.
there's some things that are binary in nature that sort of, before I get yelled at from all my libertarian friends on this, there's some things that are binary in nature in X-ray and MRI. There's some services that like we roughly know what they cost. We're not talking
Yeah,
about like the totality of doctors being able to charge what they view as appropriate, but there's certain services
yeah,
that are mostly binary in nature, right? You go in, you get them, and it should fall within a certain cost curve, and it just doesn't. Like
that's right.
it's 10, 20x, 30x the cost from if you go to X versus Y,
That's
right?
right.
Yeah.
That's right. That's right. And I think there are ways to do this that are still in keeping with the American libertarian ideal in some
Yeah.
ways, right? Like every person should have purchasing power. Like we should give people the ability to use the market to create incentives for them to do well. Like these are all things that are, I believe, important. We believe in choice here, very much. And a lot of countries that have chosen to administer their healthcare system differently don't give as much space for choice, even as an example. And so we can figure out ways to do it that are in keeping with the sort of values of this country, but that start to move towards saying we have an obligation to be better more responsible arbiters of how we spend our dollars, and we have an obligation to address the fact that we're just not getting value for the healthcare system as it's currently constructed at scale.
As we sort of talk about some of these more democratizing access and care and government supported plans and all that, one of the arguments I've heard is like, hey, well, why do people from Canada come over to the United States to get certain service, and why does it take 6 months to get an MRI? I don't know what the number is. I'm making this up, but people will tell that to me, and I don't know if that's actually factually true. But hey, certain types of service in Canada take so much longer than it
Mm,
does in the United States. And why do all the best doctors in the world, why do they gravitate to the United States? And are we going to lose that
yeah.
in going down this other idealistic path that we just sort of touched on a little bit here? What do you think about
Yeah,
that?
no, it's such a great question. I mean, I think, and this is what I'm sort of trying to land on, where I think there's so much that's good about the way that this country stimulates innovation, attracts like brilliant talent, and has been for a really long time at the forefront of medical technology development, of new therapeutics. It's partly like all the things that are challenging also that sort of fuel this, right? Like, which is there's an ability to make a lot of money um, pushing the envelope in healthcare in the United States, right? There's an ability to fund innovation because the return potential is dramatically higher here than anywhere else. Like, that's why people want to, you know, develop new drugs and sell them in the United States market, because the ability to kind of really, really benefit from that is huge. I think there's such a big gap between being Canada or being the United Kingdom and where we are today, that there's still opportunity to say, okay, let's align our policy in a way that raises folks who are at the bottom to what we as humans and as a society can say is a sort of a minimum acceptable access and quality of care. Let's get them there, while not curtailing the ability for others with more resources to pay to buy on the private market what they wish. Like, I have my own sort of personal feelings about that. I think we can do more to kind of get in the middle here. I think it's obscene that some folks have, you know, ready access to skip the line for. We saw this during the COVID vaccine rush. People were skipping the line to get access to drugs. They could get someone to come to their home and provide them a scarce vaccine because they could afford to pay for it. Well, the patients I was serving in Brooklyn were suffering and waiting, and and had their resources. That feels obscene to me, but I'll allow it. If people care so much about it, I'll personally allow it. I think it's possible to preserve that ability, and also say that we can and must do better for people who today are totally falling through the cracks. Like, it's an indictment on us as a generation of leaders, as a generation of people. I'm sort of making some assumptions about your listener base, but by and large, these are among the one percenters or approaching.
Sure.
It's an indictment on all of us that there are people today who don't know where their next meal is coming from in this country, the sort of wealthiest country on the planet. They don't know where their next meal is coming from, and they don't know how to access basic healthcare services, preventive care, primary care, and mental health. Like that, we got to do something
Yeah, it's
differently.
interesting. Like, you can hold both thoughts in your head that you don't want Canada, but also we can do better. Like,
Yeah,
those two
it is
thoughts are
possible.
actually, it's possible. You
They're
like
not mutually
I can
exclusive.
hold, and it's amazing. I mean, not to like all this stuff gets so politicized, and so it's hard to even. You have to be one way or the other in all these things. But like, we can raise the floor and keep what makes it great,